What are the main issues that people come to you with relating to sex?
Mm-hmm. Well, probably the most common sexual issue is a mismatch of libido, a mismatch of desire for sex and therefore willingness to engage in it between partners. And that is probably the most common problem that exists. And it is the most common problem that someone like me would see, which is not to say that anybody has in that couple pathology in terms of their level of desire or willingness to participate in sexual activity, but simply that across the board, there is a large bell-shaped curve of desire, and it can fall into, quote, normal, because there is this wide range. But when people pair up, whatever their sexuality may be, heterosexual, homosexual, bisexual, if they have different desire levels, that can create difficulties in the relationship. And so that is the most common issue that people present for.
And this will be very stereotypical of me, but I assume that typically this would be a man saying my desire would be much higher than my wife's or my girlfriend's.
Well, that is a fair assumption in the sense that more often men do present with more desire than women do. Women, basically across the board, right? If you look at sexual research and you look at understanding, even within the psychoanalytic framework or other psychological frameworks, men's sexuality tends to be more, I guess I'll say, direct, linear. What they biologically experience is pretty much the same as what they register in their mind as desire. And for women, it seems to be a lot more complicated. We could be looking at, medications that have come on the market for men that have been super helpful to men when really they only affect the biology and the vasculature. Sorry. I realized that was going to be plugged in for me. Sorry. Okay. They only affect the biology and the vasculature of their genitals, but that also affects how they register their level of arousal, etc. And for women, it's really not that linear. And in fact, there's still a fair amount that's mysterious to sexual researchers and the public at large about women's sexuality and how they register arousal genitally and then in the mind. It doesn't correlate all the time. It definitely does not. And so there are other factors that come in that have to do with female desire. And so, yes, it is more common that the man would like to have sex more often and the women don't necessarily want to as often, or they want something else, or there's this mismatch. But I will tell you that I have seen plenty of couples where actually women want to have more sex and he doesn't. And the problem there is that it doesn't fit that stereotype that you're talking about. And so women often feel very embarrassed. They feel ashamed, like, what is wrong with me? In addition to, it's not fitting, stereotype. I thought men always want to have sex. And so what does that say about me if he doesn't want to have sex as often as I do? So that is in some ways more difficult, and it's more difficult for couples often to come in for help when that's the case, because both of them are embarrassed by this more so than the other way around.
If the female sex drive is perhaps much more contextual, perhaps than the male. I'm not sure if that's the right word, but perhaps a little more complex than the male. What would be perhaps the most common or stereotypical questions that women would then come to you with about their sex lives?
I mean, there are a host of others. So I was talking about mismatch, but of course, individual sexes come in with individual problems. For men, that tends to range from premature ejaculation or difficulty maintaining an erection, or they want other things that maybe they have difficulty communicating to their partner. For women, it does tend to be presenting with low libido, and men do also present sometimes with low libido, for sure. But women are more likely to come in with wishing that they had more libido, or actually pain on intercourse, dyspareunia, just pain in any sort of penetration is a common issue for women to come in with, but low desire is definitely an issue that women will present with as well.
If the male sex drive is on average much more straightforward, perhaps much more biologically fueled, and if you have this scenario where the female does have the higher sex drive, and the male says, the man, sorry, I've got a headache tonight, I can't engage in this right now, I could imagine that on average the woman might take that much more personally, perhaps it's much more detrimental psychologically than it would be to a man in the opposite direction. Is there something in there?
When couples present with mismatched desire either way, it does really hurt the relationship. And that's often why they're coming in, right? Because somebody is feeling rejected. Somebody is feeling a lack of intimacy and a lack of being desired. It's also important for men to feel desired. And for many men, having sex with their partner is the intimacy, right? It is, women may often say, well, I feel like it doesn't even matter if I was there or somebody else was there, as long as they were having sex. And which is not true, often, but sometimes is true. But for many men, the sexual acts themselves are intimacy, are their way of expressing that intimacy for their partner. For women, they may feel like, but intimacy would be more talking about our feelings and you expressing how you really feel about me, and our sharing our vulnerable words and emotions with each other. And if I'm not having that, I don't experience this as intimacy, this act. So there can be a mismatch on that. But there definitely is this sense of, I need to be wanted by my partner. I need to be desired by my partner in order to be aroused. And so you can see in that sense, it becomes kind of a catch-22, like a circular, like you're not expressing desire for me if you say I don't feel like it tonight, and then I feel rejected, and then I don't feel desirable, and then I don't even feel aroused myself. So it can be sort of a race to the bottom, if you will, of nobody wanting to engage. Sometimes, sometimes, by the way, that low desire for a man isn't even just low desire. These problems are very complicated because sometimes it's maybe he had difficulty maintaining an erection, or he does have premature ejaculation, and it's embarrassing for him. He feels like there's something wrong. Therefore, he doesn't want to present in the bedroom. He doesn't want to feel failed. And that only amplifies the problem, right? If there's a bad experience, now he's sort of hiding out. If he does it again, he might because he's anxious about it, he will have another bad experience. And so it can be a complicated problem that you kind of have to tease out. Some of it's education about, it's like very normal to not be able to have an erection 100% of the time, or it's very normal in certain circumstances when you're feeling stressed to have premature ejaculation. It's sort of teasing out, explaining, helping both people understand, maybe doing some behavioral skills that help in whatever might be the specific issues. But I will tell you, to your original question, that for a lot of the sexual research points to how vitally important a part of arousal, being desired, is for women. That a lot of their sexual arousal and ability to orgasm has to do with, in their mind, seeing themselves as highly desirable. and, seeing themselves through their partner's eyes as highly desirable. And that, perhaps even more so than for men, is really, really central, as it turns out, to a woman's sexual functioning and, sexually functioning well.
And assume that, just as a blanket statement, that on average, desire fades in relationships over time. Kids happen, life happens, you spend all your time around the other person, perhaps the lack of, it creates a lack of mystery and whatnot. How does that get triggered again?
Yeah, that's a great question. That's like the money question, right? And I wish I had just some great, do this. Because there's a couple of things, as you alluded to. There's, the stresses of life. There's the commonality of being together all the time and not being new, right? And new is what new play, new experience does trigger the dopaminergic system in the brain, which has to do with reward, which has to do with arousal and feeling good. And so when there is no new, that is, more of a challenge. But I'll also tell you another factor that's really come to bear is today for a lot of age groups, let's say particularly under 50, pornography and the internet and sort of what they've been exposed to a lot potentially also wreaks havoc with desire and sort of being desensitized to what then may come to be not arousing enough to them in their minds, because they've been exposed over and over again to more and more, highly erotic material that makes other things seem not new and makes them seem very ho-hum. And so it is challenging, I think, for a lot of couples. Often, depending on the situation, right? I used to be sort of maybe prescribing some pornographic material, like mild pornographic material, to watch together to help with arousal. But increasingly, I'm finding myself trying to talk partners into stopping all their, or as much of their pornographic, really his often pornographic viewing, which is changing his threshold for what is exciting. But for couples that have been together for a long time, it is about trying to create some newness in the situation. And there are definitely things that, couples haven't, shared particular fantasies together that would be new, haven't tried sexual acts perhaps that would be new, haven't even just putting themselves in a setting that is different. What are these, the kitchen, the backyard, doing things that are even a little new, do help. Even what you wear, at least to start with, but what you talk about, it could be any of the senses. It could be, any number of things, but we try to look at what might be a little new and a little erotic for a couple to do.
Would you ever, for instance, advise people to just start going at it, even if the desire is relatively low, and perhaps it might create a positive feedback loop? Would you ever suggest that?
Yeah, there's definitely a fake it till you make it strategy. Absolutely. I am not unlikely to talk to, especially when there is, a relative mismatch of desire, to talk to, right? Because we're talking about compromising. So you're not going to make someone have a totally different level of desire, but, or libido, but you are going to be talking to them about the health of them as a couple and how therefore you can have some compromises in that. And part of that is often, it might mean the high desire person is accepting a little less sex than they would ideally like in the relationship, but that the lower libido person is doing a certain amount of, because this, as I said, it might be more commonly the woman, if she starts, even though she's not feeling in the mood, it is not unusual to be moving, now I have to work with the male about things that actually would help her, and would help her to be in the mood. And often it's actually, so like sometimes you really start at the beginning. So the beginning being certain things that you're going to do together that don't end in sex, but are erotic for her, so that she can experience desire without the pressure and the anxiety of, and now it has to be, it has to end with sex. So we might start with, massage, and then erotic massage, and but with the rule essentially of, and you will not progress to sex, and that you might do that for some period of time, which might help her to grow arousal and desire, without. For women, because I said as it's more complicated, in terms of neurological wiring, so to speak, it's very hard for a woman to be anxious and aroused at the same time. That's like a good evolutionary process that we've developed, right? If there's a bear chasing us, we don't want to just be suddenly in the mood for sex. Like, you want to be channeling all your sympathetic nervous system to running, and blood flow to muscles and not to genitals. And so there's a biology behind a lot of this. It doesn't serve us well in some circumstances. So it's hard to be anxious and feel like having sex. And so it's taking the anxiety off the table initially, giving her a chance to have experiences that stoke arousal and stoke desire, and then move from that. And then it may be a certain amount of, okay, you weren't initially experiencing arousal or desire from across the room, but you're going to start, and the rest will follow. But you kind of want to have this earlier stage first, so that she gets a chance to know what following feels like, and have that sort of to move toward, if you will.
I love it. The next time I see a woman getting chased by a bear, I shall not approach. I was going to ask. You mentioned a couple of, I think, really excellent tips there. Kind of like, physical massages. Obviously, there's an intimacy. There's a physical touch. Are there any others that perhaps you note are, I guess, that could be perhaps really useful activities for couples to try to perhaps invigorate that desire?
Yeah. So it sort of depends on what the issue is, right? That they're trying to get to. Sometimes it's about a couple who really aren't sharing emotional intimacy, right? And that's really important. So it may be about what they talk about. If you think you're just going to talk about like the annual budget and who's picking up who from school and nothing, literally the nuts and bolts of life, and then have great sex. It's, so it's sort of like, what is the quality of what you share with each other? Here's where it becomes a bit, so on the one hand, you want to share emotional intimacy and feel that you can really trust your partner. You can really be vulnerable. They like you, love you, are attracted to you, even knowing all those vulnerabilities about you, right? That's important. But then, as I was alluding to earlier, right, there's a certain amount of mystery involved in sexual desire. So I guess what I would say is I can't give everybody like their homework assignments, because it depends, a little on the individual issues that are going on with the couple. But I would be trying to identify, like, where is there emotional intimacy and vulnerability? Is there a problem there that for us to work on? And then if they're pretty good in that department, it may be that as you kind of were also alluding to earlier, the ho-humness of like, there's no mystery, right? It's just like, we literally pee and poop in front of each other and do, like everything is just out there all the time. And we do it the same exact way. Now there can be a comfort in like, I know what you like and you know what I like. And like, we do have a routine and it really, really works because we've really, really honed it, and that's good. But sometimes to keep desire going, there is a desire for some new and for some mystery. And then it is about creating like some mystery. And so like that might be, that's what I was saying, like the something new, or I didn't know that you had that fantasy. Or, I'm going to, sometimes I have couples like read fantasy books together, that someone else has thrown out an entire book of like sexual fantasies, and like, what do you think about that one? What do you think about that one? Like, want to try that? Or does that turn you on? No, that's a turn off. Okay. Like what, it's sort of these are new frontiers of sexual thought. And then of course, there is the issue of like, if there's something very specific, like a not small number of men struggle with premature ejaculation, and they want it to be, first of all, not a lot of women have orgasm with intercourse alone. I think most people know that now, but there's still some men who maybe don't know that, or they've been led to believe like if they're really good and it's really good, then that should happen. But the reality is, anatomically, for women, that is not super likely to happen. And so sometimes it's a matter of sitting with the couple and saying like, she needs a lot more foreplay, and here and here, and here's how. And, she, ideally, I mean, it's unlikely she's going to just with intercourse alone, like maybe 15, 20% of women might be able to over time, but that's not most women. So it's sort of some instruction of, here's what she needs stimulation wise. If you're desperate to have it during, you don't want a woman to feel failed because she's not, and you don't want a man to feel failed because she's not, because that just makes no sense. So it's sort of a matter of, are you willing to use vibrators? Or other toys? Are you willing to learn new techniques? Are you willing to get her off before and then, okay, whatever, or get her off after? But, if she knows the deal is sort of, she has to just be like, okay, well, that's fine. Nothing happened, then there's the problem. So it's, you're encouraging flexibility, you're encouraging learning, you're encouraging the idea that you weren't just innately supposed to know this, and that understanding the anatomy and the neuroscience of sex will really help you, and will help you as a couple. Will help you even if you're not a couple, to be frank. But if you want to be a couple, I was starting to say earlier, a lot of men do struggle with premature ejaculation. Sometimes it is their biology, and there are definitely things you can do. Specific methods. Most common behavioral method is something called the stop-start method, which hopefully a partner is willing to participate in. It's sort of noticing the upcoming triggers that you then want to stop specifically, even, squeeze at the base of the penis to prevent ejaculation, or, moving to orgasm, stop, wait, start again before you get to that threshold. Practicing this technique basically treats premature ejaculation, but other things can also, taking serotonin reuptake inhibitors, which is usually used for depression or anxiety, but it turns out that the side effect of those is delaying ejaculation, which isn't so great. Yeah, if you don't have that problem, I mean, SSRIs are unfortunately have the rep, and it's true, of sexual side effects. Sometimes those sexual side effects aren't good. And that's more commonly a problem that I face, treating young men or young women who do have depression or anxiety disorders, and they don't want these side effects. And we have to try to work with that. Because for a woman, delayed orgasms, can really be a problem. And for a man as well, it really can. And if it affects arousal, well, that's a big problem all around. So it depends. But a very small dose that's not really being used to treat depression, anxiety, because it's not a high enough dose, can help men with premature ejaculation to just not have it. So, there are lots of different kinds of problems. So the treatment is sort of tailored to that.
It seems to me from what you were saying, and for instance, from other things that I've read from authors like, for instance, Esther Perel, that attraction seems to be, in the perhaps the unknown, perhaps keeping your partner off their feet just a little bit. Do you perhaps agree with that kind of statement? And do you think that, I guess, things that come into my mind, like learning a new skill, trying a new class, just perhaps keeping your partner off balance just a little, might also be another tactic?
Having some mystery is a tactic. But by mystery, I don't mean keeping them insecure. So, when you say keeping your partner off balance, keeping your partner insecure, maybe I still am crazy about you. Maybe I'm not. Maybe I'm looking in another direction. Maybe keeping your partner insecure. No, I don't think that's a good strategy. And I think, you might have sex, but like you're gonna end up breaking up. I mean, it's I don't think that's a good strategy, but I do think, that yes, working to create mystery within the knowns, or creating, as I said, new, whatever new might be. Like new could be like, we as a couple have not tried. This is a biggie, like you see all these dating shows or like Bachelor and falling in love with someone you don't know. And you might notice that the majority of the time they set them out on a date to do something that is a little death-defying. We're going to dangle from a helicopter. We're going to, we're doing all these, kind of a little scary things, right? Adventure things. And there have been studies that have looked at exactly this. When you take two people, they could be strangers, they could be partners, and you put them in a kind of scary, I don't want you to risk your life, you know what I'm saying? But like a little bit like an exciting and highly arousing situation, even if it is a little scary, but it might just be like really exciting. That arousal that your brain experiences gets transferred to the person that you're with. And so, doing something, it doesn't even we don't have to be in the bedroom. Doing something with your partner that's like exciting, and new can be folded into that as well. So like, let's try whitewater rafting. Let's try doing something together that we're both like, woo, and then, but we're together. And that arousal definitely gets transferred to your person or that person. And that could be a source of like, and now let's hit the bed. So I think uncovering mystery about each other, creating mystery for each other, doing exciting, arousing things. That's what, sometimes like, okay, maybe treated a couple, their house was on a golf course. And I was like, well, what is a low, I don't want you to go to jail. But like, what's a low prob time that people will be traipsing across the golf course? Like maybe there's a little risk, but like, I don't want you to go to prison, but like, maybe there's a little risk, like put a blanket out there, do it outside. Somebody might see you, it's sort of a matter of like, what are their fantasies, and like, what can you create that's a little exciting.
Well, I do love golf, so if I see that on my golf course next time, I'll turn the other way.
Be okay. You'll understand.
I'll
You'll understand.
understand. So we've talked obviously about a number of different, I guess, psychological, perhaps even biological kind of ways we could look at this. In your view, and I guess from your clinical experience, is there also a case that if there is such a big gulf in desire, is there a kind of just a cynical view that says this will at some point either end the relationship or, dare I say, perhaps lead to one partner having affairs or anything like that? How do you kind of view that one?
I mean, it is difficult. I think it is a real hardship. I think that usually the partner who doesn't want to have sex feels a little in denial about how much that affects the other partner, or feels angry that it shouldn't so much affect the other partner. I often try to talk to couples about, going a year with no sex is asking to have a problem, in your marriage, in the survival of your relationship. And yeah, I would just say, in my experience, I know there might be people who listen to this who are like upset to hear this, like I shouldn't say this, but I would say that in my experience, yeah, not having sex, when one of you is not happy to not have sex, doesn't work. And either, you end up splitting up, or as you pointed out, likely someone strays. And sometimes someone sleeps with someone outside the marriage, and the person who really doesn't want to have sex has sort of tacitly agreed to that. And on the one hand, you could say, well, maybe that maintains the relationship that person's accepting and willing to have. And sometimes that is the case. But I would tell you, oftentimes by sleeping with someone else, they end up leaving anyway because they become attached to someone else. So it doesn't necessarily work to just turn the other way. Often that person ends up leaving. It's just sort of a stepping stone out the door. It is hard to maintain that status quo. Now, it's interesting. I was sort of recently out of my fellowship. I did my sexual dysfunction fellowship with Helen Singer Kaplan, who's like a giant in the field of was kind of one of the pioneers, I guess I would say, and big in the field of sex therapy and sexual dysfunction. And I would say at that time, the idea that there were couples who basically were not having sex. She didn't want to have sex, and he was having difficulty with functioning. So as a result of difficulty with functioning, he didn't want to have sex either. And they had a status quo, and that remained for a long, long, long time. But about that time, Viagra came on the market for the first time. And suddenly you had a bunch of men who were like, this is great. Now I can, it sort of supersedes my dysfunction, and I want to. And they were approaching a partner who didn't want to, who had not wanted to for years. And so there was a big spike in relationships breaking up, because it really accentuated this issue tremendously, and because there wasn't a medication for women. And still to this day, there isn't a great medication for women. There really isn't a medication that you can just take and just, changes desire, or arousal. And so, that sort of created, in some ways, many men were delighted. It really, really helped them. Obviously, it's a $1 billion business. But it's been a problem in that, there isn't a counterpart for women.
I would kind of just also love to shift gears here because I'm also really interested in psychoanalysis. And there's a quote that I love from Carl Jung. It's one of my favorite quotes. Until you make the unconscious conscious, it will direct your life, and you will call it fate. And I would love to kind of ask you, in terms of our, I guess, sexual desires, our sexual choices, I get a feeling that, that people take a real, how could I put it, a kind of a free will approach to this, that these things are kind of consciously chosen. But I've been wondering about this, so I'm kind of just interested to know, what role, I guess, our unconscious, our formative years, past experience, what role they play in kind of shaping our sexual desires and choices.
Well, I'm glad you asked that because so far we've really been talking about sort of the neurology, biology, and the psychological approaches that go with that, cognitive behavioral therapy, which is not vested at all in looking at the past and looking at your unconscious. And there are sex therapists who would argue that there are a number of diagnoses where one should stick to that arena, right? That's where the money is. But I would argue, and I'm a psychiatrist. I prescribe. I do cognitive behavioral psychotherapy. My fellowship in this was at least, I'd say, 80% cognitive behavioral. But I then also did psychoanalytic training, and I would tell you that you absolutely the cognitive behavioral approach has its real limits. So if you're talking about premature ejaculation, but yes, partner choice, sexual identity, gender identity, functioning within a relationship, all of these things are, of course, affected by our unconscious. Now, Sigmund Freud also commented on the fact that, well, first of all, the whole tenet of psychoanalysis is that our unconscious deeply affects our behaviors and our cognitions, our conscious cognitions, and that without making those unconscious thoughts conscious, it continues to have the power to drive behavior and suffering, and that by making it conscious, we can get the power back, right, to essentially control our behaviors and our conscious thoughts. But he also made a lot of references to women being the dark continent, because he really didn't understand women's sexuality. He fully acknowledged that. He tried to think of it like Little Men or something. But he acknowledged that didn't work. And so he also acknowledged that he didn't, understand we didn't have a good model and of course, psychoanalysts have made progress since that time, but it is different for men and women unconsciously. Yes, early life experience definitely shapes everything from, early attitudes about body, about sexuality, about masturbation, about early life experiences in terms of partner choice, in terms of shame, about one's own everything, from how you view yourself to what is okay to do and not do, who you should pick. Everything. I would argue everything, right? And so often enough, right, people who present with a sexual problem do have life experiences, do have either their model of their parents or earlier relationships that have really shaped their sexuality. What one fantasizes about is not necessarily what one wants to do in real life. Case in point, many women have as one of their top sexual fantasies rape, but they don't want to be raped. Absolutely not. But it might be arousing to think about it. And if a woman does find it arousing to think about basically being forced or having sex with a stranger or lots of things that she would never want to have happen in real life, it might be so shameful and so uncomfortable that she can't even consciously register it. And so sometimes really working with women has to do with understanding early life events and attitudes and what is being basically repressed, right? For men and women, what is being repressed and can't come into the conscious that might actually help you to A, not have shame and discomfort, and B, more aroused because you can access that now. So repression is a real issue in terms of dealing with this material, and also what's called, basically repeating the trauma, repetition compulsion, which means something early happened that was in a way traumatic for you. You have not worked it through. And so the brain wants to repeat it as a way of trying to reprocess it, rework it through. And unfortunately, that means many people come into the office. Why do I keep picking a man who, is cruel to me or harms me, or is a raving narcissist and actually doesn't even matter who I am? Why do I keep, and men too, why do I keep picking this same partner that is dysfunctional for me and I end up miserable, but I'm aware now that I keep picking the same person or the same traits? And so that is not a cognitive behavioral treatment. That really does require understanding unconsciously what is pulling you to that. How can we look back and understand what happened and understand how you processed it and process it further in a healthier way, that you don't have to keep repeating those same self-defeating patterns, choices of, whatever, the daddy you didn't have, or the daddy you did have, or you saw your parents cheating on each other, or you saw your parents abusing each other. You saw whatever it may be. What is drawing you to this same repetition? And understanding that has the power to free you to make different choices.
That's really fascinating. And I guess one of the difficulties with, the unconscious, is of course the name of it. It is unconscious. But I'm assuming that, for you as a clinician, that if someone comes into you with these perhaps patterns, as you said, perhaps there's something there that goes back to childhood, or they keep on picking the same partner over and over again, which is no good for them. Does the unconscious, for instance, does it leave clues that you can then pick up on and start to work through?
That's exactly it. That's what a psychoanalytic treatment is aimed at. And by the way, it could be called psychoanalysis if you're going in, 3 times a week, 4 times a week, and you're lying on a couch and you're not getting any cues from your analyst, so that you're free to, one of the main tools is called free association. You're talking whatever comes into your mind. And that's what provides the clues, allowing yourself to tap into and free associate. Looking at dreams is another sort of tool to use to understand what might be going on unconsciously. But that work can also be done in what's called a psychodynamic psychotherapy, which, uses many of the same principles, but you're usually sitting up. Maybe you go once a week, twice a week. But it's a different style of exactly that. Some of the clues are picked up from what's called the transference, the relationship between the patient and the treating practitioner, what that patient transfers onto in the relationship, their doctor, essentially, right, is not from the doctor if the doctor's doing a good job and not revealing a whole bunch of themselves. That's the whole point, right? They're remaining sort of mysterious, not just to be a jerk, But to be, I mean, some people experience that. I don't like that. Why my doctor won't tell me anything about themselves. The point is, it's a tool that when the patient says, well, you this, or I feel this about you, or I think this about you, or my fantasy about you is this happened, or you did this, that's data for them to understand about the unconscious of the patient and their past experiences. So they're likely to frame their doctor in a way that has to do with their own relationships and their own unconscious conflicts. And so in trying to understand those unconscious conflicts, that's another tool. So, you know, the tools used in psychodynamic psychotherapy and psychoanalytic psychotherapy are different, are extremely useful. And it is often a longer treatment, is a more in-depth treatment, but I think, you know, as opposed to cognitive behavioral therapy, which might be great for, like, say, a very short-term problem, it sort of might last a shorter time, and the treatment also may last, you know, in terms of its outcome, may last a shorter time. This is more about changing, you know, understanding unconscious conflict in order to change repetitive patterns of feeling and behaving. They make big life changes.
Bringing it home to kind of my real life experience. I've had many friends across the sexes which have, you know, had repeated relationship breakdowns. Some of them have been, you know, very, very, you know, nasty endings, and, you know, the person is, people have said to me, you know, I know that I have this type. Maybe, as you said, they're really cocky, or they're narcissistic, or, you know, and I'm not saying in, you know, in clinical terms, I think those, but, you know, but in general, they you know, that kind of person. But they say, you know, it's just my type. You know, I don't know if I can't change that. It's just the type of person that I go for. Can that be changed?
You know, treatment only works for those that really want to engage in it, want to make change, are willing to go through maybe some, you know, suffering along the way. You know, it's not always fun, you know, um, and you know, I guess the short answer is yes, but, you know, not everybody can make those changes. But the person who is saying that's just my type and that's just the way it is, you know, it's a certain amount of denial. Like they don't really necessarily want to change that right now, right? And you really have to be willing to pursue this, you know, in a pretty active way. It is a fairly big investment. Or they may not know that really that is changeable. Now, I'm not saying they're going to go from, you know, like, I just am only ever attracted to, like, a bad boy who, you know, who abuses me. But I am saying that if they can understand very much so the thread of where that came from, why it was mixed with the erotic for them, why it got mixed with sexual attraction for them, then making that conscious can really help them to actually change that attraction. Yes. And also be able to look for other elements, perhaps of a constellation, to maintain the arousal, to maintain the attraction, but without the peace that is like the death knell, you know, for them.
I love that. I love that so much. And yeah, we're huge proponents on this show for that kind of that self-awareness, which you mentioned there, and that reflectiveness. So thank you so much for sharing that. I've absolutely loved this. I got 2 quick fire questions before I let you go and ask you to tell these guys where they can connect with you and whatnot. The first one, I guess, would be perhaps just bringing everything home today, from, you know, your clinical experience, your personal experience, everything that, you know, you've studied. You've got an incredible CV. If the person was tuning into this now and they were to just take away perhaps one tip that they could use to improve their sex lives, what would you love to share with them?
Get really good at stimulating your own body and experiencing desire for yourself with that, because that ultimately is the knowledge that you want to give a partner. And if you don't know it yourself, which a lot of people come to me and they don't, they really don't. That is the key first, most important thing, which a lot of people just have never really accomplished for themselves. And being able to see yourself in that very sexual and erotic way, and knowing what absolutely works for you and is most stimulating for you, and then being prepared to be able to share that with someone else, I think is like the most important first key. Really, honestly, like the first homework assignment sometimes is often going home and learning to masturbate well.
Simply for Gail Saltz today, what makes your life worth living?
Oh my goodness. I mean, I love what I do. I'm incredibly fortunate. I know, a lot. I have such meaning in my work. I really feel incredibly fortunate. I have such meaning in my work. I'm also incredibly fortunate. I am married for 36 years to the love of my life. And we have a wonderful, wonderful marriage. And I have amazing children. Like I'm very fortunate in my personal life. I think, I think more and more people are struggling with, feeling lonely and feeling, sort of removed from each other, and feeling, and undervaluing really intimate relationships, really building intimate relationships, which is the number one source of happiness. It certainly is true for me, but I think that it's true generally. And I think it's really important for people to, if they're struggling with that, get help for that. But to invest in that. Yeah. So those two arenas I've been very fortunate in. They are what bring the meaning to my life.
Dr. Saltz, where can these guys connect with you? And is there anything else that you would love our audience to go and check out?
Sure. Well, I am on social media, Instagram, Dr. Gail Saltz, Twitter, X, but Threads, Blue Sky. So I'm around on social media. Instagram is a good way to reach out to me if you're looking for something. I often do make referrals for people. I at least in the U.S., ASECT is the Association of Sex Therapists, that for somebody really well trained. And if you're looking for help either as an individual or as a couple, is a good place to go. And for a great psychotherapist, analyst, I'm the department head for communications for the American Psychoanalytic Association, and wherever you are, or in Europe, it's the International Psychoanalytic Association, to look for somebody who is a well-trained psychoanalyst in your area.
Amazing. We will link everything below. This has been such a pleasure, and I really, really enjoyed myself. I learned so much. So thank you so much for coming on the show.
I so appreciate you having me on. And if you choose to delve into another mental health topic, you let me know.